It's time to get geoing, so pull up a chair and join us at our kitchen table for golden opportunities. If you've ever had a kidney stone, you know you don't want another one. And if you've never had one, consider yourself lucky. But you need more than luck to prevent this pain-producing experience. And Pam Kreider is here with steps that you can take to keep kidney stones from forming. Pam is a certified nurse practitioner in senior health and wellness at MetroHealth. Welcome back to the show.
Thank you.
So let's talk about kidney stones. What are they? Why do they occur? What's going on with that?
Right. We'll start first. A kidney stone is actually a hard crystal mineral material that is formed in the kidneys and the urinary tract. There are many types of stones, but calcium is makes up the majority of the kidney stones. Calcium that is not used by your muscles or your bone, they go to the kidney. So a kidney stone is formed when there's a decrease in urine and/or an excessive amount of substance that form a kidney.
Okay.
So a kidney stone can lodge anywhere in the kidney, anywhere in the urinary tract, from the ureters to the bladder. Risk factors can be anywhere from not drinking enough water, which is a big one. Men actually get more kidney stones than women, something they get more than we do. Age actually plays a factor, anywhere between 20 and 70 years of age. Eating a diet that's high in protein, and certain medical conditions such as diabetes and hypertension and even gout, and certain, health conditions, and certain medications such as diuretics increase the risk for getting a kidney stone.
Okay, so how do we know when we have a kidney stone?
Well, if you ever met anybody or know anybody that's ever had one, they will tell you pain is the biggest factor, excruciating pain. Although some people don't have pain, but pain is a big factor. You can have abdominal pain, cramping, you have pain in your lower back, pain on the side, or sometimes you can even have some growing pain. You can also have a fever, you can have some nausea and vomiting, or you can have the sensation that you need to go to the bathroom more often than usual, than you normally go.
Okay, so it sounds like we don't want to have this thing happen.
No.
So how do we prevent it from happening in the first place?
Sometimes you can't prevent them, but the biggest thing to do is to drink lots of water. Having fluids, and water is the best. Try to drink at least 2 liters a day. Limit your sodium intake to about a teaspoon a day, and that actually includes the sodium that's in your food.
That's hard to do.
It's hard to do, so you got to sometimes read the labels and see. And also talk to your doctor about some of your medications that can increase the calcium forming in your urine.
Okay, so we're going to try to prevent it. Excuse me. We know when we have it, it's nasty.
Yes.
It's a lot of pain. So what is the treatment options? You know, what do you do if you find you have a kidney stone?
Most kidney stones actually pass on their own within 48 hours. The treatment is actually to drink water, and sometimes the pain can be controlled with, over-the-counter Tylenol. But if the stone is too large and it doesn't pass, then you need to go to the hospital or to your doctor. They can order tests, a CT, ultrasound, and depending on the size of the stone and where it's located is where they generally form the treatment plan.
Okay.
I don't want to get into it too much, but there's things called lithotripsy where they can go in and break up the stone and you still pass it.
So if it's too big, they can break it down so the little pieces can get out.
Yes.
Okay.
Yes. But the biggest thing is prevention. So drink water, talk to your doctor about your diet and your medications, and then you go from there.
All right, that's valuable information. So follow Pam's advice to kick kidney stones to the curb before they make themselves at home and harm your health. My thanks to Pam for joining us today.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org.